Hi, this is Jill Schiaparelli with HealthTech Talk Live. We are broadcasting to you worldwide on the iHeart radio media platform. We are here today on the floor of the UBM Canon Medical Design and Manufacturing Conference in beautiful Philadelphia. And we're talking to innovators throughout the medical device and product life cycle and getting their perspective on what's happening that's new in the market. I am joined today by Martin von Dyck.
Yes.
He's the Executive Vice President of Hydromer, which is a polymer coating provider. Martin has a background in engineering and finance. He's been with Hydromer for a long time. He's seen a lot of innovation in polymers during the span of his career. Welcome, Martin.
Thank you very much for having me.
This is a fantastic conference. There's a lot of great innovation going on out there. Can you tell me briefly about why Hydromer's here and what your company does?
All right, well, it's quite logical for us to be here because this is where most of our clients will be, because Hydromer is a company that basically sells to other medical companies, primarily those companies that sell products that doctors would actually use on their patients.
That's important.
Very important.
Right.
So what we do is we actually put a coating, if you will, to simplify it, onto other medical products that you might be familiar with that make them very slippery when you make them wet.
Well, okay, why do I want slippery medical devices?
Very easily answer there. If a doctor has to insert something into your body, you're going to want it to be lubricated. Okay. Because one, it will hurt less, it will advance a lot easier, and in many cases with the new techniques that they're doing nowadays, they're actually going very deep into the body through a needle.
Right.
Whether it's, most people would have heard by now of what they're doing for people who have heart attacks. They're putting stents into their heart.
Sure.
They're no longer really cutting you open anymore. It's being done through a needle, either through the wrist or through the leg. But in order to make that catheter travel through a blood vessel to the heart or to the brain, you need to be slippery. If you're not slippery, you're not getting there, and they're using scalpels.
So your tagline is Hydromer, the slippery company?
Slippery when wet, and unofficially we make it hurt less.
I like that a lot. So specifically, you've been in this industry a really long time. What are some of the exciting innovations that Hydromer is working on right now for their customers?
Wow, it's really collaborative. We basically have enabled medical technology to advance to the point now where soon we hope scalpels will become irrelevant. Oh. It'll never happen completely, but so many procedures now are outpatient. I mean, where before people would be in a hospital for a week and be in pain and they have big incisions. Now going in with a needle and inserting a tube where the doctor needs it to go, that is the enabling.
Talk to me about a specific clinical application, one or two that are focus areas for you right now.
I think one of the most important life-saving one, which is what I think most people should care about, is with the heart.
Sure.
Okay, so if someone has a blood clot, it will induce a heart attack if it gets caught in a blood vessel feeding the heart. Okay. So what did they have to do before? They would cut you open, crack the chest, get to that blood vessel, and do a bypass. Now they can go in through a needle, follow the blood vessel under X-ray vision, and actually find that clog, break it free, and now insert a metal scaffolding to open up that clogged blood vessel,
right.
saving the heart, without having to implant or harvest another part of your vascular structure elsewhere. Yes. Yeah. So these things would be extraordinarily difficult if you could not have something that's absolutely biocompatible, safe in the bloodstream, non-toxic, so there's no unintended consequences, but allows the doctor to overcome all the friction forces so that you're not accidentally pushing too hard and puncturing a blood vessel.
Right.
That would be catastrophic, especially in the heart area. But it allows it now to navigate. It's sort of like taking a piece of spaghetti out of a box. It's very hard.
Right.
Now you put it in warm water for 5 minutes. It's very slippery. It's difficult to pick up.
Right.
That's what we do to other people's medical devices. to oversimplify.
Sure. That is fascinating, and I think it's a good reminder to all of us how we need to come together as a medical device community and
Yes.
partner with one another and combine our technologies for the best clinical outcome.
Absolutely correct. The collaboration that occurs here and at this show, at this venue in particular, that's what makes the heart beat here, is the collaboration
Absolutely.
between the companies.
So you can see, I know the audience can't see, but around us there's a lot of buzz and activity. As you've walked the floor, are you noting any trends that are piquing your interest?
Yes. As the engineering improves and the ability to manufacture medical, in this case, devices that are smaller and smaller,
Right.
that allows the doctors to now get deeper into the body, into the smaller blood vessels, to have greater access into the vascular structure in the brain, so we can deal with strokes, aneurysms before they deploy, going in clogs in the veins in the lower leg. So what I'm seeing here and what I really like to see is just the good, solid engineering
Right.
that allows them, one, to manufacture it smaller, and then combined with our technology to make it slipperier. That's just a match made in heaven, and basically the patients of the world benefit from this combined technology.
Awesome. So Hydromer is a New Jersey-based company. If people want to get in touch with you or the company, where should they go?
I think they can Google Hydromer or at Hydromer.com.
Okay.
We have a nice website there, and you can tunnel into whatever your interests are and who you need to speak with.
Excellent. Martin, thank you so much.
Been a
I've
pleasure.
been with Martin von Dyck, Executive Vice President of Hydromer Inc. I'm Jill Schiaparelli with HealthTech Talk Live, broadcast worldwide on iHeart Radio Media. And we're today at the floor of the UBM Cannon Medical Design and Manufacturing Conference. I'd like to thank our hosts, UBM Cannon, and I'd especially like to thank 1-800-PR.com for their PR and media support. Thanks everyone, and have a great day.